Evidence-based medicine has been delivered for years in experimental settings using computers largely, and more recently blended in with electronic health records and order entry systems. But over the years we've learned that for decision support to really be effective, it has to be blended into the workflow of busy clinicians. So today we see all the challenges that affect most of HIT also affecting our ability to do clinical decision support. And that's not surprising because, frankly, everything we do with information in the EHR or in order entry environments and the like is to support decision making. That's why we use information in medicine. As we get into the personalized medicine phenomena, of course, this becomes even more important because suddenly we're actually making decisions based upon genetic as well as other personal information that we may have about a particular patient. That's an area in which almost any clinician will tell you they need support. That their knowledge of every marker, every biomarker, every genetic flag that may be important in deciding how to treat a patient or what their prognosis is simply not something you can memorize anymore. So the information that you need to care for a patient, some of it is about that patient, but a lot of it is all the things you're supposed to know. And much of what you need to know is out in a literature that's become so vast that you can't have it all at your fingertips. But you want to be able to get to it when the time is right. And so the importance of access to generic information that may be pertinent in a given case in a way that is not interrupting your workflow and your very busy schedule has become a key element. So many institutions are looking for ways to blend information access right into the workflow environment of clinicians, and not just physicians. We're talking about all health professionals needing this kind of support. But the notion of decision support is not limited just to the clinicians. And so offering patients things that would help them have enough insight into the pros and cons of a situation that they can actually get involved in making a key decision. This is another aspect of empowerment that means delivering evidence, but in a way that a patient can really fully grasp and understand to allow them to be a full partner in the decision-making process. As we try to anticipate where evidence-based medicine is likely to be and the computational support for it over the next 5 or 10 years, it's hard not to be impressed by the personalized medicine movement and see that this recognition of the context of the patient and how that influences the way in which evidence itself is then personalized for the decisions about that patient. It's hard to imagine that isn't going to become increasingly important and pertinent. So there is a role for computational support to help as we move more and more care to the outpatient setting and even into the home environment. So it's not just a matter of going to the doctor's office. Sometimes it's getting a lot of care kind of administered right in your own home. So there's no reason that we should be limiting our thinking about evidence-based medicine and its delivery solely to hospital settings or acute care settings. It's certainly pertinent in the private practice setting where we already see many examples and needs for information access and evidence to support decisions, but even into home environments. You know, the U.S. healthcare system has many problems. One of them is trying to make sure the right information and good evidence is made available at the point of care. But the reasons that people make the decisions that they do are not purely based upon a lack of information. There are other strange and perverse forces at work in the U.S. healthcare system that can have an impact on what someone decides to do. And so when we hear data that suggests that absolutely important warnings are being ignored by clinicians in certain settings, even when the computer provides them with that information, and how does our healthcare financing system influence the way in which decisions are made, those are crucially important, and they're kind of parallel to everything we've been discussing regarding providing evidence-based decision support.